Hey guys, my name is Liz Mayer, and this is my final project for Nursing 472, the fall semester 2016 at UB. And I'm currently a registered nurse at Upstate University Hospital in their step-down neuro unit. It's 9E. And I'm doing my quality improvement project on assessing and intervening in neuro changes as soon as they happen. It's very important to have early interventions when neuro changes occur because brain means time. If someone's having neuro changes, then it means that they're deteriorating in status and they could be permanently changing due to this deterioration. A lot of neuro nursing it's much different than any other kind of nursing. Like, for example, cardiac rhythm assessment. If someone goes in and you're in the patient's in normal sinus rhythm and then they go to AFib, it's more factual. You're going to be able to see how that changed, when that changed. Neuro-wise, someone can change gradually and it could not be caught by anybody. Some of the changes that are easily identifiable is like if someone moves their right arm when they come in and then a couple hours later they can't move their right arm at all. Obviously that's a neuro change, but some changes like drowsiness could be a little bit biased. Some nurses might not think it's a change, and other nurses may think it is a change. Reasons why the patient might be drowsy, you have to look into that. You have to say, okay, like how long have they been here? If they've been here 10 to 20 days and we're assessing them every 2 hours, they're probably going to be a little bit drowsy, or if they're on any medication. Some of our medications that our patients are on are anti-seizure medications or opiates for pain, and those can also make you pretty tired. So you have to take that into consideration too. But really, when in doubt, just advocate for your patient and call the doctor. So the plan, how do we get nurses to follow through with their gut feeling and assess neuro changes and intervene quickly? We do bedside report. Bedside report is one of the things that really should be utilized by all kinds of nursing, but it's especially important in neuro. When you go in there and you do the report, you're able to see the patient, eyes on the patient. You're less likely to miss anything, and the nurse that's coming on can see where the patient's been at as for level of consciousness, etc. If there's neuro changes during shift report, that's something to take into consideration as well. Another way you can catch neuro changes is to get a second pair of eyes on the person. There's been some times where I'm not really sure if someone's having neuro changes, and I know my charge nurse knows the patient really well, or also like pupil changes. Sometimes they can be reactive to some people, and sometimes they're sluggish to other people. Or sometimes they're a 4 and they're equal, or sometimes they're in a 4 and a 5. But still reactive. If you're unsure of size or anything like that, just get a second pair of eyes, because 2 pairs of eyes is definitely going to be better than 1 when it comes to neurology. Also, look into the background, look at their previous medical history, and see if there's anything that would be causing what their symptoms are, and if there's not, call the doctor and get them assessed by the doctor. If there's really any doubt, you got to advocate for your patient. A quote to the left-hand side there. Includes the ability to successfully report a cause or interaction on one's behalf or that of another one. Requires a set of skills that include problem solving, communication, influence, and collaboration. Problem solving, figure it out with yourself, go through their history. Communication is the next step. You're going to call the doctor and you're going to influence them that this is different. You need to come up with if this person's having a neuro change. We need to do something about it. You collaborate with the doctor. You say, okay, this is our plan of attack. We're going to get an emergency. You're going to get a stat CT, and the doctor's going to look at it, and we'll go from there. And those are really the important things with it, is just voice your opinion and really say, your eyes on the patient for 12 hours of that shift. The doctor has 30 to 40 patients, so they don't know the patients as well as you do. So really advocate for them and get the patient what they need. I believe that more education will solve the problem to these neuro changes being biased or real. I think it's important that we have like a kind of biannual nursing classes where we go over types of strokes, symptoms, and go over what may be subtle neuro change to some patients. Also, like information sessions with the doctors and what the doctors really look for, because the doctors are going to come assess the patient anyway if they're having neuro changes. It would be nice if they kind of explain to me what their thought process is when they had neuro changes. And also like mandatory education. I know simulations would be pretty beneficial to us. We don't really see a lot of neuro simulations that kind of you can do with cardiac and such. So those would all be beneficial.